This patient education video is one in a series brought to you by the American Academy of Allergy, Asthma, and Immunology, and sponsored through an unrestricted educational grant from UCB Pharma.
Every person should have evaluation for something which interferes with their quality of life. If you're not feeling healthy, if you're not feeling well, life isn't as good as it can be. And in allergic rhinitis, the good news is we can do enough so you can be well.
Allergic rhinitis is often called hay fever, even though it's not associated with fever and it's not caused by hay. It's caused by allergens, such as pollen and mold spores. When you come in contact with these allergens, your nasal passages become inflamed. You'll get a stuffy or runny nose. Your eyes and ears might itch, and you might get a headache. Allergic rhinitis often gets worse during certain seasons, with symptoms becoming more frequent in the spring, summer, and fall, when pollen and mold counts are high. But it is possible to experience allergic rhinitis throughout the year. This is more common if you react to allergens such as dust or animal dander, allergens which aren't affected by seasonal changes. But be careful not to confuse allergic rhinitis with non-allergic rhinitis.
Allergic rhinitis is a disease of the nose that is induced by an immune response to an environmental agent that is contacted from inhalation. There's a specific allergic response that your immune system makes in that case. In non-allergic rhinitis, there is no detectable immune response in an allergic form, but there is a inflammation that occurs in the nose that's very similar, but not on the same basis.
Well, what are the causes of the things that people become allergic to? And often we think of the first thing that we think about are the pollens of nature, like the tree pollens, the grasses, the weeds that come out in the fall. Then there tends to be things that are in the environment more throughout the year, such as dust mites, molds. Sometimes in the inner city, cockroaches can play a role in that. Pets are a common source of things that people become allergic to, dogs and cats within that. Less frequently are things like foods that people develop symptoms from.
Allergy triggers affect people differently. That's why it's important for you to pay attention to your symptoms. Take note of when they occur, their severity and duration. Understanding what may trigger your allergies will help you and your doctor manage your allergies. When you're exposed to an allergen, your body identifies that allergen as an intruder. When this happens, the allergen causes your immune system to attack it. Your body produces an antibody, or IgE, to fight the allergen. These antibodies attach to mast cells, which contain histamine and other powerful inflammatory chemicals. When the allergen enters the body, it attaches to the IgE on the mast cell, causing the release of histamine and other chemicals into the body. These chemicals interact with receptors in various parts of the body. When they attach to receptors in the eyes, nose, and throat, symptoms such as nasal congestion, itchy runny nose, and itchy eyes may occur. With so many allergy triggers out there, how do you know which ones affect your rhinitis?
How do you make a diagnosis of rhinitis? First, the physician talks to the patient, wants to know what the main symptoms are that are bothering the patient. After that's done, then we look in the nose, the ears, and examine the rest of the upper respiratory tract from that. Once you've gotten a physical exam that suggests that it's consistent with allergy, then one usually orders laboratory tests to try to define that it's IgE mediated. And those are usually skin testing and or in vitro testing to look at IgE antibodies within the blood of the patient.
Skin testing works this way. A small amount of a diluted allergen is injected into the skin of the patient. If the patient is allergic to that allergen, a bump or a hive will appear. The size of the hive will define the severity of the allergy. The results of all these tests not only identify your triggers, but aid the doctor in determining how best to manage your symptoms and treat your allergies.
What people can do to control their symptoms is certainly trust that, in fact, it's not something that should be dismissed. Being well is much more fun and is much more important than just tolerating, getting used to, staying with the problems. So accepting you have the problem is number one. Number two, it's nice to know why you have the problem. And if it's an allergen that's a cause or an irritant that's a trigger and you can avoid it, that would be useful. Thirdly, you can decrease the symptoms by using appropriate pharmacologic agents that modify or subdue or block a lot of the reactions. And we have a number of those. And lastly, you can immunize if it's an allergic process to reduce your reaction or increase your tolerance to certain substances.
Let's take a look at some specific strategies you can use to manage your allergies. If you're allergic to pollen, you should limit your time outside during high pollen counts. If you need to be outdoors, taking your medication before you go outside will help control your symptoms. To keep the outdoor triggers out, close the windows of your house and use the air conditioning more. The air conditioner will help filter the air and control humidity, which will control dust mites and mold. To further control dust mites, remove carpeting wherever possible, particularly the bedroom. Owning a pet should be avoided if you're allergic to animal dander. If you already own a pet, keep it outside as much as possible, or at least out of the bedroom. Be sure to follow your doctor's instructions regarding the medication you take. The new anti-inflammatory nasal sprays work great, but only if you take them regularly and for the prescribed period of time. Finally, your doctor may recommend immunotherapy or allergy shots. With allergy shots, small amounts of allergens are injected into your body in an attempt to decrease your body's sensitivity to those allergens. Over time, your body will respond less to your allergens, lessening your symptoms and reducing the need for medications to help you feel better. In this program, we've given you information on allergic rhinitis, its triggers, and how to manage symptoms. And I hope one thing is clear: you don't have to suffer. Working together with your allergist, you can manage your symptoms and lead a normal life.
For more information, please call the American Academy of Allergy, Asthma, and Immunology at 1-800-822-2762. Or visit our website at www.aaai.org.